Overdose deaths and hospitalizations have dramatically increased across the nation due to prescription opioids pain medications, with Oregon ranking near the top in prescription opioids abuse. In Clackamas County, there is higher chronic opioid use per capita than Washington or Multnomah counties.
We are in the face of an epidemic. We have a public health crisis here. In the last 5 years, opioid overdose deaths have outnumbered motor vehicle deaths. That's a huge number of people who are being affected across our country, across our state, in every level of wealth, every type of community, men, women, children, the elderly. It's pervasive. It's everywhere in our society right now, and it's a problem.
What we have is a population that for the last 10 to 20 years that was brought up basically in the we're going to treat a pain aggressively with opiates in that sort of mentality. And so culture in the last 10 years, well, we noticed that, you know what, these opiates are doing more harm than good. Sure, they're helping some people. We're realizing how significant the side effects are.
After an auto accident, which resulted in a neck and back injury, Andrew, a pharmacy technician, decided to use an old prescription to deal with the pain.
I feel like in the healthcare industry, anytime you ask for pills like that, there's a stigma to it, you know, and even though they're handed out so freely, I didn't want to seem like a drug addict by, you know, going to the doctors and asking for pills. That's when I started taking pills for the pain. After that, it just kind of snowballed. I guess being in pharmacy and having access to that was when things really started to go downhill. When you're taking those substances, it changes the way you think, and you don't think about the risks. You put that out of your mind. It feels like a necessity, and it's like, it's the same as, like breathing or needing water. Your mind thinks that, if you don't keep taking these things, you'll die. Like, you need them to survive, and nothing else matters at that point. I knew that there were consequences, that my career would be in jeopardy, but I didn't think about it then, and that's just how pervasive the addiction is.
On average, 3 Oregonians die every week from prescription opioid overdose, and many more are developing opioid use disorder.
Everybody, when they take an opioid, will become physiologically dependent. In other words, your body's reaction to it is the same, no matter who you are. It's not a judgment on the patient if they become dependent on the medication. The question is when does dependency and addiction, where do those overlap? The concern we have with opioids is that dependency and addiction are very difficult to parse out.
Addiction's not a choice, it's a disease. And taking away that stigma that I know I felt and prevented me from getting help at times, and letting people know, letting addicts know that they're not alone. As low as I was, I know that there was a whole lot lower that I could have gone, and luckily I got help at that time, but I could have just as easily not, and it's something that happens to so many people, and that there are places that can help. Even if you don't have family and friends that want to deal with it, there's plenty of resources out there. It's coming out in the open a lot now with the epidemic that we're having. That just that little step of reaching out a bit can really start things going in a positive way.
To combat this epidemic, the entire community is needed to work together to form a region-wide approach.
We need to educate our medical providers about what safe prescribing is. We need to decrease the number of pills by not having providers prescribe too many, and not having them prescribe when it's an ineffective use or when it's really not appropriate or not indicated. Everybody needs to come together and be on board with addressing this issue and decreasing the number of pills that are on the street and the number of people who are dying from this.
Learn more about the opioid crisis, ways to get help, and how the region is responding at clackamas.us.